Good morning, everyone. Slowly the participants are joining, maybe because they are in different places and there could be the problem with the data connectivity, or they may be trying to connect faster. So welcome you all to the session on healthcare opportunities, that is opportunities in the healthcare industry for engineering students. One of the most important sector, like COVID-19 has witnessed the growth of the healthcare industry enormously. We are looking for 5 trillion economy in the year 2024, whereas the healthcare is going to grow up by 23%, and then it is one of the promising sector for all the engineering students, no matter whether they are from mechanical or electrical or electronics or computer science. They have got the vast opportunities. So we thought that this is going to be one of the most apt session which is required for the engineering students to explore the opportunities that are upcoming in the healthcare industry. So we are going to start at the session now. So over to Ruchika Pandey. Once again, welcoming everyone on board and on session. Welcome all the guests. Welcome Principal Sir and MR Sir onto the session. And over to Ruchika Pandey.
Thank you, ma'am.
Thank you.
Healthcare is yet to be transformed by technology, and this is why we are here today, to know more about it. I would like to commence the program seeking the blessings of our eternal leader, MJF Lionleo Muthu sir. Good morning. This is Ruchika Pandey, student of third year Department of Electronics and Communication Engineering, Sri Sairam College of Engineering. I'm privileged to welcome everyone to this webinar on opportunities in healthcare for engineering students. I would like to introduce the erudite moderator of today's webinar, Professor Malini KV, HOD, Department of Electrical and Electronics Engineering. It gives me immense pleasure to welcome the honorable speaker of today's session, Dr. Usha Manjunath, Professor and Director, IIHMR Bangalore, Dr. Ellen P. Ugargol, Dean, Academics and Student Affairs, Dr. Manjunath R., Dean, Research and Publications, and I also extend my hearty welcome to the team of IIHMR. I'm glad to respectfully and cordially welcome Dr. B. Shadaksharappa, Principal, Sri Sairam College of Engineering, Dr. R. Arun Kumar, Management Representative, Sri Sairam College of Engineering, Trustee and PRO Patel Sir, Trust Office members, Head of Departments, the Placement Officers, Teaching and Non-Teaching staff. Now I request the moderator, Professor Malini KV, to give the guidelines.
Yes, thank you, Ruchika. Thank you very much. Thank you once again, the Training and Placement Cell, and in association with the Innovation Entrepreneurship Development Center, organizing this webinar on opportunities in healthcare industry for engineering students by IIHMR. And thank you so much. And here are certain guidelines. We are throwing the poll questions, and you will be on mute, and you can definitely type your questions regarding the opportunities, regarding any questions about the healthcare industry on your chat box. And you will be given a chance to speak to the resource persons during the Q&A session. Poll will be thrown at the end of the presentation by Dr. Allen and Dr. Usha. And you will be answering the poll, and at the same time, the correct answers will also be announced after your answering the questions. And once the poll is thrown, you will be given 2 minutes time, and then you will be going through the questions and then answer it rightly. Listen to the resource persons carefully, because it is something that is at the moment, not only at the moment, it is the one which is going to stay for a long time, and this is the one which is the emerging sector for all all branches of engineering. So with this small introduction and the guidelines to you, please participate, and then ensure that you are going to, whatever the questions that you are having in your mind about the healthcare industry, please speak to them. And then there is a raise hand button also, like you can take up that one. And during the Q&A session, you will be given an opportunity to speak to the resource persons. I'll be taking up your questions as well, and I'll be noting down the questions. All questions will be answered during the Q&A session. With the small guidelines, I would like to hand it over to Ruchika Pandey, and then over to the session beginning now. Yeah.
Thank you, ma'am.
Yeah.
With this, I request our beloved Principal Sir, who works more in planning about the betterment of college and students, to welcome the gathering and introduce the speakers of today's webinar. Over to you, sir.
you, Ruchika. Namaskara ellargu. Good morning, all of you. Hope all are doing good. Respected dignitaries on the panel, our management representative, Dr. R. Arun Kumar, our trustee, Sri P. Patel, Chief Accounts Manager, Sri Gajendra Sir, and experts and invited speakers, Dr. Usha Manjunath, Director, IIHMR Bangalore, Dr. Alan P. Ugargol, Dr. Manjunath R., Dr. Sarala, and my ex-colleague, Professor T.K. Pradeep Kumar, heads of the department, faculties, and my dear students. On behalf of Sri Sai Ram College of Engineering family, I wholeheartedly welcome you all to this webinar on topic opportunities in healthcare industries for engineering students. This program is organized by Department of Training and Placement Cell and IEDC Cell, that is Innovation and Entrepreneurship Development Cell, in association with IIHMR, that is Institute of Health Management Research. I congratulate coordinators, Training Placement Sir, Mr. Bhimeshwar Reddy, and IEDC coordinator, Professor Malini, for organizing wonderful webinar, which is very much needed for the students, that too especially to our students. Coming to the topic, opportunities in healthcare industry for engineering students, especially during and after the COVID-19 pandemic. This particular topic suits very much for our students, current students. There are a lot of opportunities for our engineering students in healthcare industries. Definitely there may be one question, ಏನಪ್ಪ ಇದು ಇಮಾಮ್ ಸಾಬಿಗೂ ಕೃಷ್ಣ ಜನ್ಮಾಷ್ಟಮಿಗೂ ಏನು ಸಂಬಂಧ ಇದು, ಹೆಲ್ತ್ ಕೇರ್ ಇಂಡಸ್ಟ್ರಿಗೂ ಮತ್ತು ನಮ್ಮ ಇಂಜಿನಿಯರಿಂಗ್ ಫೀಲ್ಡಿಗೆ ಏನು ಸಂಬಂಧ ಅಂತ. ಎಸ್, there is lot of opportunities for our students when it comes to this healthcare industry. You take any equipments, medical equipments, any accessories, starting from syringe, that is needle to ventilators. So our engineers' contribution is more, and especially engineers are having lot of responsibilities and opportunities in the engineering, especially for the healthcare industry. So as I told, there are a lot of accessories and medical equipments and various things, starting from ventilators, oximeters, BP monitoring, PPE kits, sanitization, masks. Actually, when this COVID started, there was no mask available. Now, even in footpath, they are selling these masks, right? Gloves, safety goggles, face shields, thermometers, thermal scanners. There is infrared. There are various things are available. Sprayer, sanitizing carts, nano mist sprayer, big mist sprayer machines, sanitization stand, hands-free stand, touch-free. Now our students have done wonderful project in our campus through Leo Muthu Innovation Center. They have done a lot of innovative things in our college, especially with respect to this spreading this virus. For that, they have done a lot of innovative things. They did hands-free sanitizer stand. Things, especially mechanical engineers having a lot of role, having a lot of opportunities. They have very good scope after this, even during this and after. One example, you take that BIEC, they have established a COVID center. There they have set up a big number of beds and everything. I think you might have seen even cots, beds, raised cots, stands, so many things. And who are going to manufacture all these things? They are engineers. They are going to do all these things. There are some projects they have done in our college also. Ultraviolet currency sanitizers, because the currency is spreading from one hand to another hand. Even that, to avoid that virus, we have done a lot of innovative projects in our campus. There are very many food delivery box, sanitization box, disinfection sanitizing tunnel, both manual and automatic. Lot of innovations are happening even in our college. Our students, our faculties, they involved in preparing our own sanitization liquid, and even they did one keychain which is going to help. Without touching anything, they can use the keychain for operating various things. And quarantine breaching detector, so many things, even robots they have done to assist in hospitals. Our students have done projects, even one project without touching the buttons in the lift, automatic lift controller. So many things they have done. We have a very good opportunities with respect to the healthcare industry. And this is, in my view, whatever I know, I just told. A lot of opportunities are there for engineers. Anyway, the speakers are there, experts are there. They're addressing all of you. How best we can make use of this wonderful opportunity for you people. In this occasion, I take the opportunity to introduce the speakers to the online August gathering. And the speakers' profiles are very big, 4 to 5 pages. With the permission of speakers, I read only some of the highlights from their profiles. First, let me introduce Dr. Usha Manjunath to the August gathering. Dr. Usha Manjunath currently working as a director and professor IIHMR. As a director, she is responsible for all the administrative and management of IIHMR verticals of academics, research and consultancy, and training for South Campus at Bangalore. Coming to the education, she did BSc and MSc in speech and hearing, All India Institute of Speech and Hearing, Mysore, 1984. And she did MPhil Hospital and Health Management from BITS Pilani. Later, she did PhD from BITS Pilani in development of integrative framework for total quality service management in hospital. And this is about her. And she's having a lot of experience, and she received more than 20 research grants from various agencies. She's having 6 professional memberships, and Madam also presented and published more than 40 research papers. On behalf of Saira family, I heartily welcome Dr. Usha Manjunath for this webinar. I welcome you, Madam. And also I take the opportunity to introduce another speaker and expert, Dr. Alan P. Ugargol. He's a BDS and MPH and did PhD. Presently is working as a Dean, Academics and Student Affairs, IIHMR Bangalore. And Dr. Alan P. Ugargol is a a social and behavioral change communication expert, a qualitative researcher and demographer, currently researching on population aging, migration, mobility, and family societal response to aging in India. Sir is having 18 plus years of experience, rich experience in public health, social and behavioral change communication, health, and etc. Dr. Allen holds PhD in population studies, demography from University of Groningen, the Netherlands. And sir has published, he had worked for important projects like World Bank, UNICEF. Sir has published 6 research papers in journals, and he got various awards. Hubo MI's Fellowship University of Groningen, Netherlands in the year 2012 and 16. Awarded Nano Fellowship by the Karnataka Knowledge Commission, Government of Karnataka in May 2012. And visiting research fellowship, London School of Hygiene and Tropical Medicine, London, United Kingdom in the year 2005. So this is about Dr. Allen. I welcome on behalf of Sairam family, Dr. Allen sir to this webinar. I welcome you, sir. And also I take this opportunity to introduce another guest, Dr. Manjunath R. He is by education MBBS doctor, MPH and PhD in community medicine. He is associate professor and dean research and publication, IIHMR Bangalore. He was a policy and advocacy member, 11th Common Review Mission, National Health Mission, Ministry of Home Affairs, MOHFW, Government of India in the year 2017 and 18. Member, Nutrition Society of India. Member, National IDCF Secretariat in the year 2014. Member, and he is a member in various organization body. He's having 4 certification in healthcare domain. He worked in 9 important projects with different roles. He has published 9 research papers in journal. So on behalf of Sairam family, I heartily welcome Dr. Manjunath for this webinar. I welcome you, sir. And I take this opportunity to introduce one more guest, Dr. R. Sarala. Associate Professor, Institute of Health Management Research. Her academic qualification is postgraduate diploma in human resource management. She completed during May 2011 to 13 from Algappa University, Karaikudi. And she did PhD in sociology in the year 2010. And she has on thesis social networking for survival in slums, a case study of Bangalore Institute of Social and Economic Change, ISEC Bangalore. She did MPhil in sociology also in the year 2003. She completed from Department of Sociology, Bharathidasan University, Tiruchirappalli. She is having 11 years of research experience. She has published 7 research papers in journals. On behalf of Sairam family, I wholeheartedly welcome Dr. Sarla for this webinar. And coming to the students, I request all of you, please make use of this wonderful opportunity. All experts are here. They come here to share their knowledge, and they wanted to share their experience. Please, I request all of you to make use of this and try to interact with all the experts, make use of this program. And once again, I welcome you all to this webinar. I welcome you all. Thank you. Thank you, one and all. Over to
Thank you, sir. Thank you, sir. Now it's time to know more about IIHMR by listening to our resource person of the day, Dr. Usha Manjunath, Professor and Director, IIHMR Bangalore. Ma'am, please.
Yeah. Good morning, everyone. So let me just share the slides and take the session forward. Thank you very much for this opportunity. I wholeheartedly thank the management of Sairam College and Dr. Shadaksharappa, the principal. Thank you very much, Professor Malini, for the opportunity and the introductions. And I also thank Mr. Bhimeshwar Reddy to have collaborated with our assistant professor Pradeep for this. And of course, young students and faculty of IHMR as well as faculty of Sairam and staff, welcome you all. And special welcome to Richika, who is comparing for this program. And, as we just now talked about Institute of Health Management Research and what we do and how this probably will help each one of you to kind of understand what are the opportunities for engineering students. And so in the first, 5 minutes, I will take you through what we do, who we are, and then hand it over to my deans to kind of highlight a little bit more on the opportunities, especially in the IT sector. Just now you heard your own principal say a lot of opportunities and how healthcare is panning out. And rightly, like Professor Malini also said, in terms of the growth, the health sector is poised to really grow very fast, and definitely it will have opportunity for everyone. And in this era of technology, I think there is a lot more opportunity for young students and engineering background from various specializations across. So I think that was already highlighted. So let me start now in terms of once again welcoming and thanking everybody for this opportunity. About us, who we are. IHMR is the South Campus, and we are situated in Electronic City. And we have 3 key domain areas, and academics, research, training, and consultancy. In academics, we have a 2-year full-time program, Pgdm, which is a postgraduate management program. And it is deemed equivalent now through the approval by AISU, that is the Association of Indian Universities. And then we also have various short-term programs. So we have created a niche in providing quality education in health, hospital, and health IT management. So these are the 3 specializations we were offering so far. From this year on, we're also offering pharmaceutical management. What do we do in research? In general, a majority of us think research is more what's done in the lab and others. We are in various areas. We are in the public health arena. We have health system research, implementation, and research evaluation studies. As you understand, young students, there are a lot of schemes, a lot of programs that the various organizations run, like state governments, central governments, international agencies, NGOs. So they all conduct various programs. So we also evaluate those programs. So that is, contributing to policy, contributing to how these programs are doing, and overall to population and health system development. And we take up training and consultancy for various healthcare organizations in the area of management. And we are also accredited by NABET for NABH consultancy. So as an organization, we can carry out consultancy for National Accreditation Board for hospitals and healthcare organizations. So this is very briefly about us. Moving further, what is the major milestones? How is research and academic leadership? We started in 2004 as the South Campus, and it was in Kudlu Gate on the Hosur Road. And in 2010, we moved to the new campus, that's at the Electronic City. And as I already said, we are AICTE approved for. And in 2015, we received NABET accreditation as consultancy organization for NABH. IIHMR Bangalore enters into implementation research also, and we have increased research partnerships across various universities, including Mysore University, Maastricht University, and various other hospitals and others for projects or collaborative work. In 2017, IIHMR Bangalore was ranked as the top management institute for hospital management and by Higher Education Review magazine. And we have also introduced specialization in 2017 for health information technology. I think many of you who are engineering students may also be interested in looking very closely at this. In 2018, our program has been awarded MBA equivalency by Association of Indian Universities. Then IIHMR Bangalore was accredited also with MBA. In 2020, looking at the requirements, the needs of the health sector, we are expanding into the other educational programs, and we are also having one additional specialization, which is pharmaceutical management. Why would students or why would research, people who want research or various NGOs or state governments want to choose IIHMR? We are the pioneers way back in 1984. It started in Jaipur. So we have really a long experience and a legacy of 35 years. Plus, collaborations and networks. And we do a lot of mentoring to students, to collaborative organizations, and so on. Across the campuses that we have, 800 plus healthcare research projects we have done, 1,000 plus management development programs, and we have alumni base of over 3,000 across these campuses. So, we are a very unique organization, highly specialized, and we have a great legacy. Just to tell a little bit, taking about a couple minutes on this, IIHMR Bangalore has the flagship program, which is called Pgdm. It is called Pgdm in Hospital and Health Management. It's a 2-year full-time program, approved by AICTE, accredited by NBA, and accorded MBA equivalence by AIU, which I have been repeating. And this is important to understand that our program is recognized well, and it is a good program by these accrediting organizations, but a number of placement and industry people also. Specialization, just to highlight again, we have health management. When I say health management, it is with reference to the people who will learn a lot more on programs, healthcare programs, as well as NGO management and others. The hospital management, obviously, where people would like to work in hospitals and very many different kinds of healthcare organizations. Health IT management, sitting in Bangalore, this has been a very special, specialization for us. Lot of healthcare IT has advanced, and in the last 2 decades, there's so many changes that have happened. Highly specialized people who understand IT management that is specifically for healthcare. So this has been a very good specialization for us. And we are now introducing pharmaceutical management, looking at the industry attractiveness and considering the fact that South India has a lot of, biotech, pharma, life sciences industries. So this has been very and then eligibility criteria, who is eligible to apply for us is the bachelor's degree with a minimum 50% aggregate, any management aptitude test, and then further we go through a selection process. So what is the admission process? I'm sure you all have gone through one set of admission process when entering SIRAM. Similarly, we have the eligibility criteria in terms of any degree from a reputed university, and then apply online and download, and you have application. Once the application is duly filled and you are eligible, then we will call you for a group discussion and interview. This time, considering the COVID impact, we have had a lot of interviews and GD happening on online, and so our admission process is on through this online procedures. Final selection, and then admission is offered to the course and people start the program. How is it that we are uniquely placed? As you understand, management courses, across the world is also moving towards more and more practical aspects, and we have to, because it is not so much that you can have only knowledge component. Competencies have to be built for skills, for set of attitudes to work very well. So our coursework has, about 60% in the classroom learning. And then we have involved a lot of people from industry experts, then hospital visits and industry visits. We also have summer training, which is for 2 months at the end of the first year, 10 months coursework that you do. Then we have internship and dissertation to end of second year. And practically our students who are here for a 24-month program have only 18 months of classroom and other activities and industry visits and others. So 6 months is already into the industry. The actual 4 months, if you really look at, after 18 months, most of our students are placed and they're already in the internship and dissertation in the last 4 months. So they're already getting paid by 19th month onwards. Academically, there is a lot of rigor and emphasis on the development of analytical skills and critical thinking. So we use a lot of case study methods, interactive sessions, visiting hospitals and doing things, actual hands-on live projects. So these are very helpful. Key transferable skills, team working, presentation, problem solving skills. We have, like I already said, a lot of industry exposure, and we give a lot of mentorship on an individual basis. And we also have live project participation. Presently, our students are participating and they're already, kind of placed. The first year students, now they're in second year, but they already have paid internships that is happening to them. Some of them who are doing this live project. So we are offering live projects, and soon we are also looking at, entrepreneurial kind of training for our students this year onwards. This is an upcoming program, those of you who are interested, next gen technologies in pharma sector. And so we are having very interesting, and again, this is on technologies. So some of you may be interested. In addition to this, we also come up with various kinds of certificate course, development programs. So one such that might be of interest to faculty at SIRAM and students could be digital health, coursework, which is coming up in the month of September. Now I invite Dr. Alan Ugragol. So far, I spoke about who we are, what is our main verticals, what is the area that we work in, and what is the selection procedure, and how our academic course structure and program is organized. So now this would be the most interesting for all of you, faculty as well as students, the healthcare IT management. Now I invite Dr. Alan Ugragol to take over from here. Over to you, Dr. Alan.
Yeah, sorry, I was muted. So good morning, ma'am, and thank you. Ellarigu namaskara. So I'd like to take this opportunity to say good morning to all the students, faculty, principal, the hosts, and the people who have been able to arrange this for us. So it's been a wonderful exploration. I thank ma'am for that wonderful introduction to what IIHMR stands for, what we offer, and how students can make best use of this. So I'm here as a doctor trying to tell an engineering student what healthcare IT can be. Okay, so I remember the time when I actually ran away from engineering because I was a bit weak in maths. And then now as we look at the boundaries of disciplines, the way they're being structured, how there's a lot of merging, and you don't find those strict sort of boundaries between disciplines of health, medicine, etc. Yeah, I remember those days when people used to say either you be a doctor or an engineer. So now it's sort of a merging of sorts where a doctor is heavily dependent on an engineer, and an engineer also depends heavily on a doctor. So what does healthcare mean to all of us, to all students of engineering? Students could be from mechanical backgrounds, architecture, civil, computer science. So what do you all get to know as we say healthcare IT? So healthcare IT is nothing but it helps us in acquiring, analyzing, protecting information that's vital to quality patient care. So as you know, the confidentiality, the ethics of having patient care, ethics of keeping patient data confidential, these are very important factors. And the primary thing that can lead us to that is how an IT security system, how you can have your HMIS system, the healthcare management information system, how you can record data and keep that secure, which is one of the primary things that hospitals do look for. How does India stand in this sort of scenario? I mean, given the COVID situation, the principal was already mentioning to us before, right from the syringe to the ventilator, the doctor depends on an engineer. So the dependency is quite high. The interdependency is also quite high. Okay. So given the low cost, I'd like to go back to the previous slide, if possible. Yeah. So given the low entry cost that we have, the ready availability of trained talent pool in India, and the goal of scaling up manufacturing, India has a lot of potential to offer to the world. In fact, right now we are second to China, but the time has come when India will be able to step into the shoes of China. We will be able to offer more. Where can an engineer who has completed this course look forward to? He can look forward to working in a healthcare organization. He can look forward to working in a hospital. It could be a hardcore IT company. It could also be in terms of development, production of medical equipment. So the kinds of roles where you can range from being in charge of appointment and scheduling in a hospital. You could be in charge of the billing centers. You could be handling OPD queuing. You could be looking at how the bed allocations can be done in your inpatient ward. You could be in charge of laboratory. You could be looking at RFID, for example, how the technology can help you to transmit samples from one place to another, get back the reports. Pharmacy, medicine. Engineers can also play an important role in inventory and stock management, the aspects of payroll management, financial accounting, security control. So the sky is the limit. Where do you want to work? Where do you want to pitch yourself is up to you. Yeah, so that's moving on. To talk to students a little bit about what health IT can entail. What are those HMIS applications that make sense to all of us? We could have payers, we have hospitals, we have labs, we have outpatient treatment units, we have the physician, we have ambulatory wards, right? Ambulatory patients with issues. We can have public health. All of this is basically getting in information. There's a lot of medical content coming in. There's a lot of coding that happens. That coding leads to billing. So there's an entire data repository required at every hospital or health unit. And this is where a Pgdm, a postgraduate diploma in management, where you learn what does the healthcare industry really need? What sort of management skills and inputs are required? That is what is going to play an important role in how you yourself to the world. So far we thought engineering stream goes separate, medicine goes separate, but the intermingling of sorts is now very much visible. And so I can say thanks to the pandemic, it has actually opened our eyes to how much we depend on each other, right? The other examples I can think about in terms of radiology, if you look at 3D PET scans, CT scans, hardcore engineering, cutting edge technology being developed across the world is being used in hospitals. This cannot go forward without the coordination between a physician and an engineer. Yes, ma'am, moving on. So the other new aspect we all have in our hands, the mobiles, and mHealth, mobile health has become another tool that is opening up new avenues for us. Mobile health can be, you have all your information now coming onto your palm tops, right at your hands. You have portable devices to mention your simple things like diabetes, insulin checks, ECG portable devices, hypertension, temperature checks to thermal sensors, point of care devices for asthma, glucose monitoring. The whole gamut of technology is now in your hands, right at your fingertips. So this is possible because there's been an impetus on technology. And engineers have played a great role so far in understanding what the medical field wants. And this is what is going to be the future for all of us. Yeah, moving on now. So if you look at the impetus nowadays on things that can be worn on your hands, which can tell you the number of steps you did today, how is your diet doing, how is your exercise routine, things like Fitbit, a lot of devices. I mean, you can look at the plethora of items here, and it's continuously expanding. You have more and more things being offered across the world. How to maintain your diet, how do you check your weight every day, how do you know how many steps you've done, have you cycled enough today, right? A lot of technology, a lot of computation logistics, a lot of decision support happening in your wearable devices, right on your hands, right in your fingertips. So this is going to be another future which we can think of going forward. We are all now exposed to this new concept of artificial intelligence and robotics. Robotics has been there for some time. Robotics has helped the medical field to a large extent in terms of robotic surgeries, assisted surgeries, etc. Now we have artificial intelligence, and artificial intelligence doesn't only happen in, say, the engineering field. Artificial intelligence has been used for various aspects. It could help you to make a proper decision. It could help you to arrive at a proper diagnosis. It can give you options in terms of detection. It helps you keep well. So your lifestyle wearable devices also use AI. A heavy component of AI is continuously running even on our laptops, in our phones, in our watches today. AI can help you predict what sort of skills are required for a particular student. What can he do better? What can he achieve? So there's a lot of aptitude scoring that's happening, thinking about the skills of a person. Where can he reach? Research is using AI to a very large extent. If you talk about the analysis of big data, for example, it's now across the world, there's a lot of big data, a lot of pooled data, which we couldn't make sense earlier, but we are able to make sense today because we have AI at our tips. We have, in terms of treatment logistics, in terms of what can be given, in terms of cutting edge knowledge about what can be offered to a particular patient with these symptoms. So all of this is being helped through the computation of AI. I'm going forward. So I was talking about big data already. So if you look at the analysis here, I mean, if you look at the sort of organizations we have and the various things that we can do using AI, using data analytics and use of 3D. Most of you are well introduced to the concept of 3D, data analytics, etc. So engineering students are bound to find this interesting, how you can sort of create something. How can you replace parts of a human body? How can you help a handicapped person to recover? So all sorts of things that can be thought of, prosthetics in terms of 3D, how can you make available the best sort of products is again through the contribution of AI. Going forward now. Yeah. So as an engineering student, you might ask me, what sort of skills do I need if I'm going to fill into that shoes? If I'm going to enter the healthcare market, what should I know? Of course, you need technical skills. You need to have leadership skills built in. You need to have critical thinking skills. We need to know how to communicate, how to build relationships with the others of your team. You need to be highly adaptable because it is not of being, say, stringent on a particular role, but you'll have to be highly flexible and adaptable at this point. Quick thinking is an art and which has to be inculcated. Some of the common profiles that we see as an engineer who completes his Pgdm, say in case of healthcare IT management, I'm also going to talk about the interest that students have often. You can also be looked at in terms of HMIS interface support analyst. You could end up working as a clinical terminologist. You could be a data analyst. You could be a business intelligence analyst. You could be a health specialist, data security specialist, or in charge of master data. It's not that for an engineering student, it is only healthcare IT that makes sense. because I have a lot of students coming into batches each year on year at IIHMR, who tell that I have learned enough of engineering, sir. I would like to learn something on the other side. I would like to know more about hospitals now. So these sort of interest to build on some skill which you don't have, build on some skill which might help you in future is also a plus point. Whereas in the natural process, you might see, yes, after doing a Pgdm in healthcare IT, it's going to help you in your career. Of course, that also would help. So my sort of question to all the students watching this program is, do you have the skills? Yeah, do you have the skills? If you have the skills, well and good, you're already prepared for your role ahead, right? If you feel you have the skills, you need to polish them up. You need to make yourself updated enough to be able to fit into this large opportunity in healthcare. Come to IIHMR Bangalore. We'll do it for you. Okay. So with those few words, I'd like to end here, and I'm handing it back to the host, Professor Malini, to run the poll. Thank you.
Yeah, over to you, Malini.
So it was such a wonderful session that you have given, and you have just connected AI, 3D printing, and then the data, everything that whatever that is our everyday buzzword in engineering to the healthcare industry. Yes, we all know that there are many smart devices, many IoT devices which have been used in everyday use, right from the fitness bands to the other devices like location tracking of the patient and all those stuff. So it is something that, we are interrelated, as you already said, and that we are closely connected to each other. Without doctors, we are nowhere, and without engineers, it is going to be very difficult for the doctors. Yes, thank you so much for that wonderful insight that is given. Now, students, there is a poll that is thrown, and quickly answer this poll, and you will be given 2 minutes time to go through this. Please go through this. Yes, I hope all are answering. Quite an interesting poll I completed. I hope you all have completed. Yes, here is the poll results. Okay, the first question has got 85% as answer as health protection and health protection scheme based on entitlement. Entitlement. Yes, perfect answer for the question, Ayushman Bharat Pradhan. And who is the chairman and founder of Narayana Health? Perfect. 69% said that it is Devi Prasad, Dr. Devi Prasad Shetty. Perfect answer. And the Live Love Foundation, yes, it is. Oh, few of them have not got this. Like it is 35% have voted for Deepika Padukone, and it is perfect. And others, sorry, it is wrong. It is Deepika Padukone who, it is the correct answer for that question. Name a clinical trial in which the blood is transferred from recovered COVID-19. Yes, everybody said plasma therapy. 80% of them said. Others were in confusion. I guess it is the plasma therapy, which is the correct answer. And the first case of novel coronavirus was identified in province of China. Everybody knows, I think. No, some of them lost. It is Wuhan. Yes, 78% of you said it is Wuhan. Perfect. And most of you have given the good answers. Good, very good. And you can keep up your answers. And then for the next polls also, I hope the good answers will come to the extent of 100%. So with this, we are closing the first poll, and then we are moving over to the next session as the opportunity in hospital and pharma by Dr. Usha Manjunath. Thank you, Dr. Alan. Thank you so much for your insight once again. Over to Richika Pandey.
Thank you, ma'am. Now I request Dr. Usha Manjunath to speak about the opportunity in hospital and pharma. Over to you, ma'am.
Okay, so that was very good. So since all of you have got, many of you have got the right answer on the health sector, I think you're very smart, and I'm sure, health affects everyone, and we probably will be aware of a lot more than we probably think we are. So it is a very good idea to think, if we are really seeing for, what can an engineer do? Obviously, everybody requires health. One of the two sectors which impacts all of us is education and health sector. And therefore, health is a very important sector. So let's move on. And I will talk about hospital and pharmaceutical management specialization. So far you heard, we thought it's very important that you all get excited about the technologies and kind of look towards healthcare. I'm sure many of the people who take up management programs look at, general management programs. And this is also more suitable considering the attractiveness and the need, and again, the importance that COVID has, really shown for us to really do differently. I mean, as we sit here and talk, otherwise probably we would all be there in your campus and talking to you, but now this technology has enabled this. So let us quickly talk about hospital and pharmaceutical management. And I'm sure, in some fashion, not that, it is for a major illness or anything, all of us know what hospital sector offers. It is not just the hospital sector. There could be different delivery models that are happening now. It could be, delivered at home, maybe home care, or it could be like daycare. So you just go to a kind of a dialysis center, and somebody can get the dialysis done and don't necessarily have to walk into the hospital and stay there. So things are evolving. But what is hospital management is a very general term with the scope and maybe defined from different aspects. It mainly relates to management of all aspects of a hospital. This may range from patient care to record keeping to inventory of medicines and cleanliness, or to even information. So what are the different kinds of things? It could be an administrative and a management part that you can do. But if you're tech savvy, you could be doing the similar kinds of things, but move on to more technical aspects, or, manage the facility or the finances, oversee the budget part, take up various projects, or establish goals and strategies. So the hospital manager would ensure regulatory compliance. They would also be presenter to the local government bodies. So you will be managing as a manager in a hospital. It could be at across, starting from, managing the, front desk to operations to, finance to various aspects. So where could somebody be placed? Hospitals, healthcare insurance organizations, consulting firms, research and consulting in healthcare, polyclinics, home care, extended care facilities. I'm sure, technology heavy companies like Portia now are like, with what we call as Uberization of healthcare. So there are many, many formats that hospital management people who are excelling, understanding the hospital processes would be really be looking for jobs. Again, hospital technologies, I think, we can quickly move through this because we've already talked about this. But if you really see now, online appointments, would be, so there is a whole set of, technologies from appointment to, call in to simple phone to, apps to website appointments to everything connected in your ERP to, MIS and so on. So this hospital technologies from appointments to treatment and various areas. So there is EMR there is, electronic medical records to keep your records, and maybe as we develop further, we may have, instead of carrying all those papers and bags and, very familiar with all your reports and others in paper and bags, maybe we will just have a, in a soft copy and carry our pen drives, or it could be in your own cloud or wherever saved. So it can be various things that can be within a hospital. So starting from a help desk to HIS to pathology labs to radiology to blood bank, I mean, you name it, across the hospital operations and functional areas of hospital, there is going to be technology. And I think Dr. Allen said it so much more on that. And that is where, you probably would be fitting in and trying to help. One other thing that happens is there are so many more equipment, medical technologies within that. And that's where, managing that. And now, as you understand, they're all now onto, computerized. So that is where, a lot of IT implementation also happens. This is a typical operation theater. I think, if you see, I don't need to speak anymore about, what is this technology all about. So there you see, you also saw the robotic surgery arms and how monitoring happens. And it's not only the monitoring at the for the team to be working. There will be an outside telling the patient and the anxious family members of the patient, waiting to know what is the progress of this. So people are already telling through the monitors, through WhatsApp messages, how the things are happening within the OT. And all this can be also available to them instantaneously. So this is where a lot of this technology is moving, from end-to-end operations, from supply chain to actual hospital processes, but also for improving, obviously patient care, but, helping patient satisfaction, information provision. Pharmaceutical management, I'm sure now all of us are waiting for new vaccines to come by. We're hoping Oxford team vaccine will work so that we can all be maybe vaccinated and really not worry and be homebound as now. And pharmaceutical management involves management of all aspects, end-to-end solutions again, into pharmaceutical, healthcare, and wellness products. Obviously, if you see the Indian pharma sector, it's really, really poised very well. The market is the third largest in terms of volume and 13th largest in terms of value. The monetary and the dollar value. India is the largest provider of generic drugs globally. The Indian pharmaceutical sector industry supplies over 50% of global demand for various vaccines, 40% generic demand in the US, and 25% of all medicines in UK. I'm sure, you saw how even, President Trump was talking about chloroquine. So therefore, hydroxychloroquine. So therefore, there is so much more of Indian manufacturing, Indian drug industries that are doing excellently well. So this is a very important sector for us. And it also requires, and it is, again, a lot of that also is situated in South India, Maharashtra, and Uttarakhand and so many such areas. So this is a very important sector. And it also has the highest number of US FDA plants outside of USA. It's amongst the global leaders in providing quality generics to the world. So when we say generics, it's also the important part is in terms of affordability part. So across the world, India gives a very affordable, low cost, high quality, medicines. And as well as now the medical devices also come under the pharmaceutical sector. So that is another area which would be very helpful. So where is this big data blockchain technologies? If you see, every part of the technology is already implemented in various manufacturing and various companies. So if you see, all the big names in the pharma sector are already using for end-to-end. So blockchain enabled healthcare solutions like on supply chain, how to manage manufacturing, automation, and then even in terms of simulation. So all this are already connected. So this is how implementation of the technology is happening in where they're going to connect, like from patient to academia to research organizations to health authorities to clinical research to supply chain and hospitals. So this is where technology is really changing the shape and forms of pharmaceutical sector also. Again, AI and deep learning and machine learning. So if you see, healthcare and life sciences, the biggest that everybody is now looking towards. I remember, a few years back, many of you were looking at biotechnology and they said, this is going to be the thing. But now we are again looking at the healthcare and life sciences as a major area where all technologies, it's not just biotechnology we are seeing that has a spurt, but all technologies will have implementation in healthcare and life sciences. So the latest technologies of AI, deep learning, is going to really change that, whether it is customize the frameworks, like say, look at, flows, molecular dynamics, pattern recognition, and drug interaction. So within pharma sector, this is again a very important aspect. And, as I told you, those of you who are interested can log in and, join us tomorrow for that program on webinar on next gen technologies in pharma sector. So this is where it is. So far we talked about, healthcare, hospital and IT, but now it's also pharmaceutical and IT. So, therefore we have a number of opportunities for people to really look forward to. So, so we want to keep you engaged. Over to Professor Malini, I think, for one more poll time.
Oh, yeah. We are looking, our students are definitely looking for the poll because they would be interested to see that how to connect the health sector with the technology, because we are very happy to say that, like most of the students are involved in the innovative practices, and then they have made so many equipments with respect to the healthcare industry and for in the aid of the patients. Like recently in this year also, one of the student team is making the equipment which is in aid of the movement of legs when the patient gets paralyzed. And earlier also they have made smart gloves, eye gloves, and that has been sponsored by the Innovation and Entrepreneurship Development Center, Department of Science and Technology. And many of the wheelchairs have been made in the aid of the patients. So students are really interested to connect the technology to the healthcare. So this is one of such a session that which is bringing them back onto the like the track to find out many more things, including the cloud computing, IoT, and then all the latest technologies, whatever that is there, and including AI. So students, here is another poll for you to make it more interesting. Go through the poll and then vote for that, and then give the best answers. I know that you have, you will definitely go through and give the best. Your time starts now. Yes, the results are out. Okay. So the first question was your home for health, a software company in Bangalore which assess. In this particular one, the answer for this question, booking diagnostics tests, obtaining medicines, and storing health records. Few of you have given answers. Amazon Healthcare has scored 30%. No, the right answer is Practo Technologies, which you have given 23% of the people have given Practo Technologies, but the correct answer is Practo Technologies. Indians are living longer. They did in 1947, but are affected by lifestyle diseases. A lot more lifestyle diseases are all of the above: heart disease, type 2 diabetes, obesity. Ma'am, 82% have given this all of the above. So that is the correct answer. So what is coronavirus? Many of the students have answered more than 10 to 15 quiz about coronavirus. So they have given both A and B are correct as a 54% as an answer. Is that right? Coronavirus belongs to the family of virus. It belongs to the family of nidovirus. So both A and B are correct as the option C. So 54% have given that. Is that correct answer, ma'am?
Yeah, it is a large family of coronaviruses. Yeah.
Yeah. So next one is medical wearables with artificial intelligence and big data are providing an added value to healthcare with a focus of diagnostics, treatment, patient monitoring, and prevention. Perfect. The most popular brand is Fitbit. 58% have given, and the answer is perfect. So Fitbit is the one which is very, very popular, and I am sure that you have voted for that. Others who have voted for 18%, 14%, 11% for OLED and Airlord, and then another brand like Cardiac band, Fitbit is the most popular one. So at least how long should be the warm-up exercise in your physical training session? 10 to 15 minutes is the answer, and that is a perfect answer, 56%. Most of you have got the good answers, for most of it are correct. Good, very good. And all are really, really updated about it. Also, thank you so much for participating in the poll sessions. And we are moving towards the next one, which is very, very important to us. Public health is the one which is, which is the most updated one and which is the most required one in this current pandemic situation. So to talk about the opportunity in public health, we are having our the most esteemed person today, the Dr. Manjunath R. Over to you, sir, your session on opportunity in public health. Thank you.
Thank you, Professor Malini.
Thank you, sir.
Very good morning to all of you. I would like to thank the management of Sri Sai Ram Engineering College for providing this opportunity. So in next 10 to 15 minutes, we are going to discuss about the importance of engineering in public health. Today morning, while I was driving to my office, so I have a habit of listening to FM. So there was an advertisement, there was an announcement from BBMP. So what they were saying is, and you must be aware that in this pandemic situation of COVID-19, asymptomatic cases and the cases who are mildly symptomatic are advised to take treatment, to go under home isolation and take treatment. So BBMP is planning to give health kits, okay? And I was just listening to the list of health kits which they were suggesting in that. Pulse oximeter, app of this one, Optomitra, Headline, and Arge Setu app. So as today morning we were listening to your principal, Sri Shadakshar sir, right from injection syringe needle to the ventilators. So we are talking about usage of engineering in public health. So friends, we know the answer. See, we know the answer. What is the role of engineering in public health? Answer is yes. There is a lot. Engineering is very much important in every aspect of provision of healthcare. And today morning, we were discussing that our healthcare sector is very vast and healthcare sector is growing in double digit in India. And I'm sure I can make a statement here that without the contribution of modern engineering, modern information technology, this success would not have been possible in our healthcare sector. So the answer is yes, we know the answer. Health engineering is very much important and it has a very big role to play in public health. So in public health sector, so we talk about largely there are two components, preventive health as well as in curative health. In both preventive health and curative health, engineering has a very important role to present. Friends, this is a very big topic to cover. So what I would like to do is in next 10 to 15 minutes, I would like to take some of the very important examples where we are using information technology, where we are using other engineering techniques for provision of healthcare to our people. So to coming to the preventive aspects, see, we talk about there are various schemes in health through which we are providing healthcare to the people. So one of the important components in our health is provision of RCH services, that is reproductive and child health services, also called as maternal and child health services. The ultimate role is to reduce infant mortality rate and maternal mortality ratio. So how engineering is playing a very important role in this sector is we have to register all the antenatal cases, all the pregnant women into our system. We have to have a mother and child tracking system. Then we have to provide required nutritional supplements, required antenatal care through our health workers, through our primary healthcare system to the pregnant mothers. And we have to provide immunization services in time, and we have to provide immunization services to the children after the delivery. So in each of this, we have to have a system to track them, to record them, to register them in the system and provide services to them. So each and every step is very important. And this is possible with the help of this information technology, which we are using called eMamta in the maternal and child tracking system. And in immunization services to track the children. See, in our country, 70% of the population lives in rural areas. In urban areas, of course, where there are semi-urban areas, people come and they seek for services and they seek for antenatal care, they seek for help. But there are pockets, we are a developing country, we have very poor urban pockets where provision of service is very much limited. So this tracking system helps us to track all the pregnant women, helps us to track the immunization services to children, and it is very important. And coming to the nutritional supplements, we provide IFA tablets, iron and folic acid tablets, we provide nutritional supplements, we provide calcium supplementation to pregnant women. One best example which I would like to take here is one more important component is salt iodization program. See, previously in previous days, in our outpatient department, we used to see a lot of patients coming with goiter. And since 1970s, this salt iodization program, you must be aware about this salt iodization program where we fortify salt with iodine. So thanks to this program, what is this program? See, this is not a medical technology. This is purely engineering. This is chemical engineering. So we fortify salt with nutrients and we provide iodine to the population. And nowadays we are talking about a double fortification of salt. So that is provision of iron and folic acid along with iodine. And this technology is still evolving. So we are talking about fortifying flour, fortifying wheat, fortifying rice flour, and fortifying salt. So for provision of nutritional supplements to our population. This is chemical engineering. Thanks to this technique through which we are providing services. And the cost of provision of these services is very less when we compare it to provision of medicines or provision of supplements through medicines. One more important component where engineering has helped us is health HMI system. See, from our private healthcare setup, our private healthcare setup in our country is very vast. More than 80% of the outpatient care is provided through private healthcare system. And also the public healthcare system largely focuses on provision of public health, preventive health to the population. So this HMI system managed by National Informatics Center under the Ministry of Health and Family Welfare, Government of India. And this HMIR system captures the information of healthcare provision from different health facilities, compile the information at district level and at the state level, and providing the information at the national level. So whatever the monitoring indicators which we talk about provision of health services is a result of this wonderful technology called as HMI system in our healthcare system. And one more important system is surveillance system. See, we have to do surveillance, active surveillance for some of the diseases. We have to do surveillance for communicable diseases, and as well as we have to do surveillance for non-communicable diseases. That is called as risk factor surveillance for non-communicable diseases. This is a very important situation. See, we are a developing country. We say that India is in a phase of epidemiological transition. We are having dual burden of communicable diseases as well as non-communicable diseases. So it is very important that we track all these diseases. So in the surveillance system, we know there is a project called as Integrated Disease Surveillance Project. Through this, we track all the disease events and we report it from the subcenter level to the primary healthcare level, and from there to the taluk level and up to the district surveillance unit levels. And the information is captured at the state level, and we have a compiled information at the national level. And there are diseases which are under surveillance of international health regulations. So capturing information like on diseases like, say, for example, tuberculosis through this revised National Tuberculosis Control Program, capturing information about HIV/AIDS and other diseases is very important. So we have to notify the diseases to the respective state authorities, and we have to notify the diseases to the central government, and we have to notify the diseases to the World Health Organization at international level, at global level. So for this, technology plays a very important role for cross-notification and notifying of such diseases. And mapping and listing of cases. See, nowadays we are talking about geographical information system of tracking populations, of mapping diseases. The best example is which we have discussed about Arogya Setu app to locate where the cases are occurring, where the cases are situated, and to caution the people if they are going near the such localities about the example of COVID-19. So there is huge opportunity. Engineering is contributing, technology is contributing for the public health. So by looking at these opportunities, our health schemes like HIV/AIDS in the health programs of HIV/AIDS, leprosy, integrated disease surveillance project, and under the National Health Mission. So there is sufficient provision to involve engineering graduates to make this system a more vibrant one. And our multilateral agencies, World Health Organization, UNICEF, and other multilateral agencies have realized this importance of participation of engineering graduates for the success of public health programs. So they have made sufficient provision for recruitment and sufficient provision for them to participate in public health programs. One of the best example here I can give at the global level is GOARN program, that is Global Outbreak and Alert Response Network, which is at a global level, which captures the information from all different countries and alerts where this disease is circulating. So it is very important that engineering is very important in public health. To talk about next component, if I take the example of curative health services, friends, believe me, this is a very dynamic field. What happens in curative health services? See, today what we discuss, tomorrow it may be outdated technology. So right from the beginning, like in curative health services, from recording and registration of the patients in our healthcare facilities, and then online consultations, may be a diagnostic technique, laboratory investigations, or it may be a radiological investigation. Everywhere, engineering is very, very important. So, and also even for the follow-up of patients once they are discharged from the healthcare facilities. My friend, my colleague, Dr. Alan has already discussed about artificial intelligence and telemedicine, how these how these technologies are a boon to the patients in the public health. In diagnostics, so we are using engineering technique in all the aspects, be it a biochemical investigation, or it may be a pathological investigation, or it may be a microbiological investigation. For quick results, we use arterial blood gas analysis, and for all those investigations, we use engineering. And if you talk about radiological investigations, so when I was a medical student, when we were studying medicine, so we used to use X-rays and CT scans for screening the patient. So now the MRI has come, and now this intervention radiology is becoming increasingly popular. So because of intervention radiology, it's a boon to patients who are suffering from cerebrovascular accidents or those who have cardiovascular incidents. So it is a boon to those patients for their treatment. So engineering has a very big role to play in these aspects. And one of the most important aspects in the advancement of healthcare is biomedical engineering. Friends, today we are talking about artificial limbs. We treat our patients with the help of artificial heart valves. We treat our patients using prosthetics. We treat our patients using artificial pacemakers. I can give 100 such examples. The list is endless. The list is really endless. So where engineering has played a very important role for improving the healthcare which we are providing to the patients. So to summarize, friends, I would like to say, of course, health sector is growing in double digit, and both engineering and medicine are going to grow in double digits. And these are the sectors which are going to continue to grow till humanity exists on the earth. So this is very important. And with active involvement of engineering in public health, the ease of delivery of health services is at advantage, and the quality of care given to patients is improving in terms of money, in terms of time, and in terms of ease to the patient. So therefore, engineering is very important aspect in public health. It is important in the preventive aspect, as well as it is very important in the curative aspect of healthcare. Thank you very much.
Thank you, sir. Thank you so much. I just love the word that you said, that these two are the sectors which is going to be there for a long, and then I think it is a lifetime. Yes, fantastic sentence, and the message to all the students who are all here, who are all participating in this sector. Medicine and engineering are the evergreen sectors, as we all say, and the one which is going to be there till our life ends. So is that. So thank you so much for all your insight, and then about the programs that the government is giving, and then the programs and the opportunities that the students have to innovate themselves and to give a lot to the nation. And thank you, Doctor. Over to Richika.
Thank you, ma'am. Let's proceed further with a speech by another resource person, Dr. Sadla. Ma'am will tell us about the placement opportunities in healthcare industry. Ma'am, please.
A very good morning to all of you. I'm happy. I thank the management of IIHMR and Sairam College for inviting us for this webinar. I'm the associate professor here, and also I take care of the placements. So I'm the faculty in charge. As all other colleges have a campus placements, we too have campus placements. And can we move to the next slide? As part of the campus placements, we have the training and placement cell. So everyone's success is our success. So what we do is, when the students come and enter our course, we have students representative from first year as well as second year who are part of this cell. And along with the students, we have the faculty advisor, we have the faculty and staff members who support and drive the whole placement process from the first year to second year. As Dr. Usha ma'am was talking about the summer training, which we give in the first year, what we do as part of placement is we actually that students get into healthcare organization for 2 months, learn the various departments, various other things in the hospitals or IT companies or NGOs, and come back and they take up the specialization, which we discussed, the 4th specialization. So when we talk about the placement activity, what we do is, as a part of placements, we give support and training to the students right when they start from the 2nd year. So as a part of this, we try to invite people from various industry experts, and mainly we also invite our alumni. So the alumni who's there in the industries, they come, in fact, they share their knowledge about what is happening in the industry up to date. So we prepare the students to know not only the theoretical aspect of it, but also the practically what is happening in the industry. Second, we do mentoring. So as we spoke about, mentoring is important aspect in our academic program. Right when the student joins our program, each student is assigned to a particular faculty here. So they are supported academically as well as personally. Whatever support they require, we do that. And mainly they play an important role when we come to placements, where students are confused which stream to choose or which company to apply for, and what are the skill set, what are the skill sets they require, what are their strengths, what are their weaknesses, how they have to prepare. So in all these aspects, our faculty mentors support the students and counsel them and prepare them for the placements. Third comes the workshops. We have various workshops as part of the training. We have workshops from grooming tips, how to make yourself look good, confident, and soft skill trainings. We also provide various like mock GDs, mock PIs, aptitude and logical reasoning. We also train them in case study analysis and also the presentations. So these are the various ways we try to support the students from the year when they start till they get placed. That means we support them till they get placed in an organization. So if you see the opportunities, we have been talking about various opportunities in healthcare. So already we spoke about hospitals, and there are a lot of well-known hospitals like Narayana Health, Manipal, Fortis, where we have a lot of opportunity for the students. We have healthcare IT companies like Cerner, Accenture, Cognizant, Philips, G Healthcare, Dell, Ascript, and so on. And in public health organizations like international organizations, NGOs are there where you can get a lot of placements like in WHO, UNICEF, and World Bank. And also at national and state level, a lot of our students are working as district coordinators in various programs and NGOs and the recent CSR organizations as well. Apart from this 3 domain, we also have certain organizations which takes care of healthcare consultancy like Deloitte, which provides consultancy to various hospitals in US and other places, or take an example of Ernst & or PricewaterhouseCoopers. So these are the certain healthcare consultancy organizations which are having a lot of opportunities for people who are taking up our course. Apart from this, you might have heard about the health insurance companies, like for example, HDFC ERGO or Manipal Sigma, Aditya Birla, or United India Insurance. These health insurance companies also provide a lot of opportunities for our students once they complete our course. So these are some of the few healthcare organizations and recruiters. You can just see here Practo, Cognizant, Fortis, Dell, Apollo Munch, LV Prasad Eye Institute, which is in Hyderabad, Deloitte, American Oncology. So these are few of our recent recruiters, and we give 100% placements, and IIHMR Bangalore has excellent track record over the years. And every year, if you see, the package is increasing, and the last year package was, the highest package was 12 lakhs, and the average package was 5.5. So what are you might have a doubt, okay, what are the different roles I will be playing in a healthcare organization, right? I'm an engineer, right? So starting from the management trainings, you can also get into operation heads in hospitals later. You'll be supporting a clinical aspect as a clinical engineers. You can be a health and safety engineers in public health as well as in a hospital. And coming to IT companies, you can play a wide role as business analysis. You can support, analysis, implementation consultant. So when you talk about what is the support and implementation, suppose you have an app, you have developed an app or any other product. So what you do is you actually make sure that you support to develop this particular product, you implement it in the for the particular client. So your various roles are here. You can be a healthcare IT consultant, you can be an electronic medical record head or executives, you can be a solution and test design analyst, and you can be a public health engineers. So this is just few of the references I've given here where our students are working in different roles in different organizations, and especially the engineers. Moving to the next slides, if you see here, these are, I'm just have put few, these are our alumni who are engineers with various engineering background who are working in healthcare organizations. For example, Pragya, who passed out in 2013, so she's now a senior healthcare consultant at Deloitte. And Murali, who passed out in 2014, if I'm not wrong, he's a health IT consultant. So if you see, we have alumni over all the organizations where our juniors becomes the, they work under the seniors. So Pragya Patnaik, if you take example, she is the head and she under her Murali is working. So likewise, we have our alumni network, which is very strong, who helps us in placing our students. Same way we have Akshay Kumar Ghosh, who's working in Goldman Sachs, where he's a consultant and he's developing a product. Or Abhishek Mahavotra, so he's an assistant manager, business development in Continental Hospital, which is in Hyderabad. Or Pragya, who is working in Cerner as a solution and test design analyst. So what she does is, even if a product, before the product gets into a market, she ensures that the product is tested and it is approved. Or take about Charu, who's an operation head in a hospital. So what happens as an engineer, the opportunities in healthcare is wide. And we have been talking about, mainly if you see the mechanical engineers, and there are a lot of mechanical device companies or laboratory device companies like Johnson & Johnson, or it is GE, or Siemens, or Philips, or Abbott, or United Medical Laboratory, or Opto Circuits. So there are so many medical device companies where medical engineers and other engineers can play a better role. And these are some of the things, and certain other where they can play a role is, for example, quality assurance. In a medical device companies, you can be a quality assurance manager, you can be a regulatory affairs managers, you can be a quality control managers. If you are really interested, you can be an R&D design specialist. You can also be a field engineer. So there are a lot of opportunities are there for engineers to be in healthcare, be it a hospital or a healthcare IT or a pharma or a public health. Yeah, thank you for the opportunities. Thank you, everyone.
Thank you, ma'am. Now I request the very diligent and polite Professor Bhimeshwar Reddy V, the Placement Officer, Sri Sairam College of Engineering, to propose the vote of thanks. Over to you, sir.
Thank you, Richika, for giving the opportunity to propose vote of thanks on this occasion. Firstly, my sincere gratitude to our beloved visionary founder, Chairman, MBA sir, because of whom we all are here today. My sincere thanks to Sri Sai Prakash, sir, Chairman, CEO of Sairam Institutions, for giving opportunity to organize this type of webinars. My heartfelt thanks to Dr. Adaptation, Principal Sri Sairam College of Engineering, for his continuous support and backbone for this program. Thank you, sir. I extend my thanks to Dr. our management representatives at institutions for encouraging to organize more webinars for the student community. Thank you, sir. I thank Mr. Patel, PRO, and Trustee for this community. Thank you, sir. My special thanks to today's speakers, Dr. Usha Manjunath, Professor and Director, IIHMR, Dr. Alan P. Ugargol, Dean Academics and Students Affairs, IIHMR, Dr. Manjunath R., Dean Research and Publications, IIHMR, Dr. Sarla, Associate Professor, IIHMR, and Mr. Pradeep Kumar, Assistant Professor, IIHMR, for their very good inputs to the students. Thank you all. I extend my special thanks to all head of the departments, faculty, and students for making this webinar success. Last but not the least, I thank Professor Malini, HOD, Tribly, and Richika Pandey, third year ECE, for their perfect moderation. Thank you all.
Thank you, sir. Yeah, Ruchika.
Yeah. Thank you, ma'am. Now the speakers of today's session will be answering to all your questions. I request Professor Malini KV to moderate Q&A session. Over to you, ma'am.
Thank you, Ruchika. Thank you so much. Thank you, Reddy sir, for your formal vote of thanks delivered. Now it's the time to listen to our resource persons answering all the questions that is posted by our students. Let's begin the session. I would request our resource person to kindly answer these questions to make the clarity, to bring in the clarity in the students' mind. One of the student by name Venkata Krishnan is posting a question. What is the meaning of T cells? And what about clinical trial updation of Covaxin? Could you please explain? Over to the panel. What is the meaning of T cells? And what about clinical trial updation of Covaxin?
Yeah. Shall I take this question, ma'am?
Yeah. Yes. Go ahead.
Yeah, this is a very good question. Thanks for this question. So in our immune system, we have cells as part of the white blood cells. See, we say white blood cells, red blood cells. So as a part of immune system, we have lymphocytes that freely circulate in our blood. So T cells and B cells, they help us to fight against the antigens which enter our body. Okay. So these T cells are direct fighters of foreign invaders, and also they produce cytokines. So they help us to, bring immunity against foreign invaders. And Covaxin, as you are all aware, Covaxin is our indigenous vaccine, which our Bharat Biotech company, Hyderabad, is preparing this vaccine for COVID-19. And ICMR, Indian Council of Medical Research, are also part of it, this initiative. So now phase 1 clinical trials of this Covaxin are going on in the field in 12 different sites of India. So this is a very good hope that we might get this vaccine when it completes all the phases of human trials.
Thank you so much. Hope Venkata Krishnan got the answer from Dr. Dr. Manjunath, there is one more question. The students are asking, what is the scope for the engineering students from the stream of electronics, computer science and mechanical in the healthcare sectors, and how they can go with the post-graduation in the healthcare sector?
Thank you very much. So as we discussed through our presentations, information technology, electronics and communications is very important. See, when we talk about medical devices, when we talk about provision of healthcare services to remote areas like telemedicine, so these are very important aspects where engineering is very important, particularly information technology and communications. Electronics is very important for medical devices. And we have seen in one slide where in our operation theater equipments, there are so much of electronic equipments which we use for our healthcare technologies. And mechanical engineers, so definitely mechanical engineers are very important in our healthcare system. Like it could be, provision of ventilator systems, or it could be, moderation of air conditioning system in the hospitals. So for all those things, mechanical engineers are very important. So I request even other panel members, if you have more opinion on this, you please answer.
I'd like to sort of take over from Dr. Manjunath here. I mean, he's given a very good explanation of how public health needs engineers. A lot of aspects, even in terms of logistics, supply management, in terms of hydraulics, as he was mentioning about the ICU. I mean, even when you enter a hospital, from the time you enter the hospital, even from these screens that open, the glasses, these sort of glass panels that automatically open, even starting from there to the lift, to the patient lifts, a lot of mechanical hydraulic devices operate in a hospital, in a healthcare setup. So be it public health, be it hardcore hospital, we are completely engulfed by devices. There are devices at every stage. Even your patient appointment automation is now online. So you can have an app where you try to get a patient appointment from home. Hence, from software to hardware, there is an entire dependency that exists, interdependency between the healthcare sector and the engineering sector. And this is something that we must strive to use and sort of mobilize going forward. This is, I mean, this whole webinar itself is becoming an eye-opener, even for me, when I'm able to see more and more thoughts being coming up about, look at the interdependencies, look at how much we are connected. Without this, that doesn't work. Without us, that doesn't work. So this is going to be the future. We will have to strive, work forward. So the opportunities for students are enormous. Like I was listening to the earlier talk by Professor Malini, where she was talking about the live projects they have done. They have worked on assisted devices in terms of kinesthesiology, where people who could not move were able to move using these devices. A lot of work has already gone in. So this is what we need to capitalize on. And the opportunity is, I mean, the sky is the limit basically in this case. Thank you.
Yeah, can I just pitch in a little bit? If I'm really talking about electronics engineers or computer science and others, the area to move forward is either you, go for higher education and higher end technology itself. So you could do like MTech and so on. The other part is joining these companies where it is manufacturing. So if you're an electronic person, there are product companies, there are startup companies, there are various opportunities where R&D, for example, so where there is going to be direct product development, research in it, and so on. So it could be GE or medical electronics that we talk about. And as you understand, in India, a lot of the medical devices sector is still to develop. We're still very slow on it. We depend on lot of technologies which are in various other countries, and we import a lot of those technologies. So with the sector which is now talking about Atmanirbhar or Skill India and various sectors, this is where you probably want to either take up these kinds of, if you're passionate about healthcare, if you want to work in this sector, it could be a direct job that you're looking at, or it is fine-tuning your own education and going forward. The other is what we talked so far. Let us say you are a technology person, technology is, you're interested in technology, but you also you're very passionate about healthcare, and what is the, alternate or a faster route is you do a program like, maybe ours, and then, take it forward where you will be helping, you have technology, you understand healthcare now because of this program, and then you will probably be in implementation and all the things that we so far talked about. So the route for you, if you are, and is very many. I was in BITS Pilani, the distinction between various kinds of engineering background. I mean, majority of you learn a lot of IT and programming and all. So whether you're a mechanical engineer or a chemical engineer, so many of you will probably be very tech savvy with respect to IT, or if you want to add on more into AI components. So if you're really seeing you would like to go further to improve your skills and competencies, because the digital skills, the AI skills, the modeling and others are becoming very important for you to grow further. So I think taking it forward from Dr. Manjunath, where he said, yes, this is important for you to start working, and where Dr. Allen said, yes, there is hardware and software part of every engineering background area that you are there. And if you say, for example, what is there for civil engineering and architects and all, there is a whole range of new hospitals coming, architecture coming, green technology coming into hospital. So there is, sky's the limit, but you need to focus on which is the route that you want to take. I think, that hopefully helps you kind of understand, there is role for everybody, but how you really pitch yourself, and move further is, what you want to really, take it up. But healthcare definitely needs you all. And, because I know coming from BITS Pilani, a lot of students do not think healthcare as a very viable option when looking for placements or looking for higher education, and really taking up a lot of the hardcore healthcare related one. But there are a lot of opportunities. If, let us say, for instance, you may be an engineer, but you are more good at marketing, let us say, then you are, I have seen engineers who have done excellently well in healthcare marketing. So I think the opportunity is look at your skill sets, your interests, whether it is higher education you want, or you want to go into management education, or you want to really take up jobs in healthcare. So there is an enormous opportunity, but yes, the times, I'm sure youngsters today are a little concerned and worried about this particular juncture with COVID, but I think this is going to resolve, and more healthcare jobs are going to come. And like Dr. Manjunath said, this is evergreen field. People are going to get sick. If not COVID, maybe some other coronavirus might come. So healthcare is going to be there, but then we need technology solutions and a lot of innovations and startups. So if you have those kinds of urge to start your own, there are a lot of such opportunities also. I'm sure you have done excellently well at Sairam with maybe your entrepreneurship cell, as well as your labs and products, and many of you have already worked. And I think connect to your mentors, connect to your own placement this way, and see where you match. And I think you can, we can guide to a certain extent, where our expertise are there. So we are open for further interactions, and if you need support, we will definitely be connected through Professor Malini and Bhimeshwar Reddy.
Excellent answer, ma'am. You really read my mind. I wanted to ask you all these questions. Seriously, in one shot, you gave me all the answers. Fantastic. And one of the last question is, what are the popular skills for engineers in healthcare industry? Because normally we speak about two things. One is the technical skills and the other one is the soft skills. And when we start training the students on the skill set, because industries always, came up with the saying that there is a huge skill gap from the expectations of the corporate and the would-be graduate of college. So we normally train them from the training and placement cell, and in all aspects, 360-degree aspect. Like we train them in all aspects right from the third year itself. So in particular, is there a skill set that is looked upon by the healthcare industry from an engineer?
Can I take that question?
Is there a particular skill which is looked upon by an engineer in a healthcare industry?
Well, the specific answer is there is no specific skill set. Okay, the answer is going to be broader, because if you look at the way technology is moving, the way people are providing solutions. I remember the time when I was doing my Master of Public Health about 13 years ago. At that time, telemedicine was a very big thing, and they were thinking that telemedicine could reach to the remotest parts of India, and we could have a lot of specialist physicians being able to consult with the remote physicians and help them. Sometime the sort of propaganda was that this is a technology which is not needed, right? Technology for the sake of being created. If there is no demand, if there is no necessity for the technology, it is not going to work. And secondly, compounded by the fact that there was such resistance from the physician community for going forward with technology. So there is always some reluctance, there's always some resistance when you're thinking about who is going to use that technology. I'm reminded here about the technology adaptation model, the TAM model that people normally say. Technology takes a certain time to be imbibed, to get acculturated into a society. So there's some sort of time gap that the technology takes. Now, if you talk of telemedicine, 13 years hence, I'm also surprised. There is so much sudden impetus on telemedicine. We now realize that we can't go to the doctor. We now realize that we cannot get an appointment. We have to do everything virtually. The doctor who was hitherto completely reluctant to meet his patients online, who didn't want to even WhatsApp the medicines, right? Who didn't want to call patients, is now forced to sit in an online call. So these are the evolving skill sets. So what I want to tell to your question is that adaptability becomes very important now. The student can no longer think that, okay, I know AI, so I'm just waiting for something very big to come through AI. No, you have to be adaptable. Reading the mind of what is required at this moment in the healthcare industry, that really makes you this thing. So what I can say is skill sets you learn at your college. I'm sure Sairam is doing a great job in building engineers of various streams, ECE, whatever, CSC, whatever it can be. But ultimately, when you join an organization, when you get into a location where you have to adapt,
The person who is able to quickly adapt, who is able to critically think and think, what can I do here? Or how can I contribute my skills? How can I engage with the medical team and come up with a solution? That is the guy who's going to be successful, right? And for that, you need to develop those skills. So there is that focus on managerial skills, team building skills, communication skills, management skills, all of that comes together. So that part of a building exercise is required if any engineer feels he can succeed at a certain level in healthcare as well. I hope I've answered your question.
Yeah, thank you so much, Dr. Alan. It was a fantastic session with all the panelists.
Just a quick this one. I think, Dr. Allen put it very aptly, about flexibility and, working in, engineering students, obviously you're all young and you have, fire in the belly. I think the most important is passion and inquisitiveness. And I think, this is very important. You are going to work with various sectors. Maybe it is banking sector, maybe it's an IT company, whatever. I think one he already said is about the flexibility. Everybody is going to talk a different language. I mean, in healthcare, the doctors, nurses, the providers, the government people, the policymakers, everybody is going to talk a different language. So you have to be, having a very good, attitude or an aptitude. You can develop it in terms of working with people, communication, but in the end, problem solving. I have always known engineers to be problem solvers. So, so therefore it's important, fine tune your skills and whatever that you choose, if you want to be in healthcare, it is a kind of a sector which there is pain, there is challenges, there, a lot of things are not known. You see how COVID is moving. So you have to have that passion. You need to, say, well, I will find a solution, I will do it. So that kind of this one, and also like, inquisitiveness. So passion and inquisitiveness, if you're passionate, this is where, it's very important because that's what will make you work hard. I'm sure that is what will take you forward. Yeah.
A great message by every panelist here. Fantastic to have you all here and to combine the two different sectors which are called as professional sectors as well. So fantastic. So the key takeaways of this session are engineering and healthcare is always connected and will be connected and it will always stay same. And all, all the engineering participants here who are all going to be engineers will have a great opening in the healthcare sector, and definitely you can go from the energy to the 3D printing, and that is the mechanical engineering. So you need the healthcare sector needs the energy, healthcare sector needs the electronics, healthcare sector needs the communication, healthcare sector needs the chatbots, healthcare sector needs the AI and the cloud computing and the big data. And we all are going to support the health sector through our innovations. Once again, thanking every panelist here for your time and the consideration and participating here with all the curious participants. And thank you, beautiful audience. Thank you for being here with all of us. Thank you, Reddy sir, and thank you, Richika Pandey, being with me and then moderating this session as well. And thank you, the panels, and thank you all doctors. And I'm sure that you are all really having tough time, making this nation a healthier one. Thank you, and once again, namaste. Thank you. So, Reddy sir, thank you so much. Thank you, Reddy sir. Shall we move to the closure of the session?
Sure, ma'am. Sure.
Yes. Once again, thanking every participant and all the panelists, Reddy sir and Pradeep sir. Once again, thank you to you all. Thank you. I'll leave the session.
All this to all the students and stay safe and keep your smiles on.
Yeah. Very nice to know you all, doctors. Thank you.
Thank you.
Thank you. Thank you.
Bye-bye.
Thank you.
Bye-bye.
Bye. Thank you. Thank you, sir. Thank you. Bye.